Now, today there's been about a 100% jump in the number of coronavirus cases in Ghana. Health Minister Kweku Menu at a news conference to update Ghanaians on the cases said 25 new infections have been confirmed after lab testing of some 185 persons who were taken into quarantine, setting up the possibility of further increase in the numbers as more tests are conducted.
So the 185 test results received, we have 25 of those quarantined tested positive. If we add on to the earlier number of 27, it means we have 52 tested positive in our country at the moment. Those in quarantine, we have actually deployed psychologists to have chats with them. We are also in the process of handing them over to our case management teams we have set up. And they have started taking them to isolated centers for case management, meaning treatment. Definitely, not all of them will be critically ill, and they are not. Some might not be ill at all, but decisions on them will be on individual case management issue. If you are not even found to be ill, you still have to stay in quarantine for the mandatory 14 days. Earlier on, we were getting indications like if you test negative, we may release you after 4 days. But on advice, technical advice, and we've met all the doctors, we cannot do that. So we'll have to keep you for the entire 2 weeks, which is the 14 days. We have adequate room in Accra, various centers, to actually take care of all those that have been tested positive at the moment. But going forward, we have a team that is going around, identifying places that we can set aside for isolation for case management, not only in Accra. What we have identified so far is that we can describe 2 areas in Ghana now as our own epicenters, Accra and Tema together, and Kumasi. We are doing what we describe as contact tracing. In Accra, we have deployed 98 field officers, epidemiologists, and community health officers that have been trained to be doing the tracing. And it looks like we are actually succeeding in getting to people. In Kumasi, we have deployed about 50 trained people who are also doing contact tracing. The advice I will give now, by this evidence, is the fact that wherever we are, all those of our brothers and sisters who have come in, we should advise them to put themselves in self-quarantine if we haven't tried them yet. And they should also be talking to the health authorities in the area where they live to send teams to observe them. They can be calling on telephone and be describing their conditions to the health officers they get in touch with, so that we can protect the rest of the population against community spread, that is the horizontal spread we are seeing in our country at the moment.
That's the Health Minister, Kweku Menu. Now, the head of our health desk, Fred Smith, was at this news conference. He joins me in the studio. Let's do a bit of analysis. Fred, good to see you. So the numbers, quite a few of them, what do they mean?
Well, Kojo, we've been putting together the numbers that were given to us today. And if we check the 185 people they said they've tested, out of those in quarantine, we've been told that 1,030 are in quarantine, then it means that we're having about 17.9% of that 185 that has been tested testing positive. So the 25 persons who've tested positive are about 17.9% of that. Now, it leaves us with something like 82.1% to deal with, and that means 13.5% of the 185 who were tested are positive. If so, the 13.1% of the total will bring us to something like 139 cases on the assumption that we get the same figures.
Yeah, same percentage.
Same percentage figures for that. Right. That will bring our cases to something like 139%, and then you add on the previous case, 25, that we had before. That will bring us to, say, like 160. Of course, we know 2 have already died. And so those are the numbers. It could shoot up quite significantly when everybody in quarantine has been tested. But of course, this is scientific work, and once that is done, we'll get the actual figures.
Yeah. So this is a sort of all things being equal calculation.
Equal.
We're looking at least all things being equal,
around 160 for our total.
Total,
yes.
By the time we're done, and then you add 25 to that, and we're looking at 185.
No, after the 25, you'd have around 160.
About 160. Yeah. Right. Okay. Well, let's certainly hope that the science gives us better news.
Yes.
But beyond that, those in quarantine, there are some concerns about them. What seems to be the current issue? Well,
a lot of them are going on social media, calling friends in the media and other places, complaining. Some of them say they are not having food. Some have got food, they don't like the food. Some are there, they want something that they are not getting, one thing or the other. And we had at this news conference a representative from the National Security to explain what they've been given, the briefing they've given to these persons who have been taken into quarantine, and the kind of support that they're giving to them. And from what he said, any of these persons who is experiencing or having any challenge can reach out to the authorities so they can address them. We can hear from Obi Dixon, who spoke on behalf of the National Security.
Right.
Country. Now, pursuant to those directives, the Ministry of National Security, the National Security Council Secretariat, and also the Ghana Health Service put together a team that has been putting into motion an operation, codenamed Operation COVID Safety. And so, pursuant to putting across such an operation, a number of issues have actually cropped up with it, largely very successful in the manner in which it has been handled, and also fraught with some of the issues that the Honorable Minister has here mentioned. But permit me first to just begin by giving you something that will be a roadmap or a chart that gives you some clarity as to the manner in which these quarantine procedures have been effectuated, particularly under the operation. And so this is how the walkthrough is, at least for those who seek to know how it actually unfolds. The first is that prior to arrival at KIA, the Kotoka International Airport, the pilot informs passengers of government-imposed mandatory quarantine. Subsequent to that, the immigration officials board the aircraft that come onto our tarmac or arrive in Ghana to confirm if passengers have been rightly informed. Now, if they have not, they pass on information to passengers before their disembarkation. 3, at the arrival hall, port health officials are the first in line to meet these arriving passengers and conduct medical screening of the entire passengers that alight. Point number 4. Passengers then move to complete their immigration formalities. Point 5. Whilst all this is going on, the airport announcements keep blaring and visiting repeated announcements of the need to observe social distances, just as we in this assembly here have observed some good social distance. Now, at that stage, the information on mandatory quarantine is again re-echoed to all passengers. Passengers move to the carousel thereafter to collect their luggage and wait until they are called to board their buses. The passengers return back through immigration, port health, and then drop their luggage in a conveyor belt that leads to a waiting track. Passengers then proceed to a standby bus which takes them to the destination. Now, on board the bus, a designated official informs the passengers on the destination or the quarantine facility and takes questions from passengers. The exercise is sometimes done also at the destination hotel to avoid delays at the airport. You could imagine the number of arriving passengers that come.
Yeah, and once again, we keep hearing the use of quarantine instead of quarantine.
Quarantine. It's actually quarantine.
That's correct.
If you check the, well, it's British and American pronunciations, still quarantine.
Yeah, that's how you say it right. All right, then. Now, let's talk about the measures that the president announced. It's been a couple of weeks now since the president addressed the nation and announced some measures which have been escalated with the recent closure of our borders. Yeah. But are these measures enough to stop the spread of this virus?
Yes, we heard about some arrests at some of our borders. Aflao, there have been some arrests. Our borders, our western border, Elubu, there have been some arrests. Our northern border, there have been some arrests as well. So we know that the officials or the security is on the ground and will do a good job on this. But there are some unscrupulous people who appear to be taking advantage of the fact that some of our security men can be, compromised, can be corrupted. So they try to do some of these things. And we've had reports of some persons who are arriving through Togo into Ghana and finding a way out of this situation to still enter Ghana, even though our borders have been shut. And at this news conference, we had the Deputy Comptroller General of the Immigration Service, Lord Ofori Afrifa, explaining the measures on the ground and the fact that Aflao is very crucial now because Ethiopia Airlines continues to fly into Togo, and therefore there will be some persons who may have plans of coming to Ghana and will definitely go through Togo and find their way through our land borders to enter. We can hear him.
On his passport revealed that he had flown in through USA. Ethiopia Airlines continues to fly to Lome. So we are watching that border post very closely because that is where we are seeing the tendency of persons moving through. And significantly, this Ghanaian is a medical doctor. We expected him to know better. The other two are Ivorians. They all hired vehicles from the Aflao border and were moving to Accra. The drivers and the vehicles have also been arrested, and they are all being sent into mandatory quarantine. And thereafter, the issue of prosecution will be considered. From Elubu this morning, 21 persons have also been arrested attempting to enter illegally. 5 Ghanaians, 9 Beninois, 3 Nigerians, a Malian, and 3 Ivorians. They have been sent back, but the Ghanaians have been retained and are being sent into mandatory quarantine. From our northern borders, totally shut. There have been attempts by Nigerians and Burkinabes to travel out of the country in buses. They have been stopped. Honorable Minister, ladies and gentlemen, we want to send a word of caution to our border communities and the transporters. We are not in normal times. So the manner they have been operating in conspiring to smuggle people in and out of the country should cease. The border communities form a critical part of our border management strategy. We expect them at this time to cooperate with the security agencies. They should rather inform us of illegal entries rather than aiding them. when the coronavirus hits, it will hit them too, and it will start from them.
Right. Well, that was the Deputy Comptroller General of the Immigration Service, Mr. Lord Ufure Ifrifa. Now, Fred, 1,030 people under mandatory quarantine. How has compliance been, with this quarantine so far?
Well, generally, they've complied, and government appears to be happy about that. But more importantly, the general population appears to have complied with the measures rolled out by President Akufo-Addo. Okay. And the Information Minister, Kojo Ponkroma, spoke at the news conference and said that, yes, we commend all Ghanaians for the role they've played in trying to comply with this, but there are some unscrupulous ones who are still bent on breaking this, and he wants all of these people to come together. He thinks that and indeed that's what it is, that this is a time when everybody must support a common agenda to fight a common enemy. We can hear him.
Out of our brief, because it is very critical. The decision was to close the borders and to put into mandatory quarantine those who were coming within that period, because it was becoming clear that our biggest risk was from importation. And just to go over those numbers, about 1,030 persons are currently mandatorily quarantined under the supervision of the National Security Secretariat, working in collaboration with the various agencies. Samples for 611 of them have been picked. Even as we speak, they are going through the process of picking those samples. We're told it takes about 25 to 30 minutes to complete the extraction of samples from one person, so it takes a while. They've done about 611, they are still doing it. The first 185 that have gone through the PCR testing, 25 of them, that's about 14%, 13.5 to 14%. And that shows that this vertical risk is quite severe, or was quite high, and that is why it has become necessary to take this measure. As the Minister has mentioned, those who are positive are going to be moved to an isolation unit for treatment. The case managers, the clinicians, the Ghana Health Service, they are very much on top of that. And those who've tested negative, if you have 13 more days to go or 12 more days to go, depending on when you came in, that will also be managed. We acknowledge that it is uncomfortable, but it is something we need to do for the greater public good. All support services needed to assure the comfort and medical support of the persons in quarantine, even at this time, is being stepped up by the state. We strongly advise persons in quarantine to cooperate with the security and health officials enforcing the mandatory quarantine. It is in your own interest to do so. Even the mere interaction among yourselves puts you at severe risk. As uncomfortable as the situation may be, now is not the time to disregard the rules and attempt to disrupt the laid down protocols. Officials are doing their best to provide you with as much information and support as possible, but please cooperate with them so that you don't put yourselves and others at risk. We're also noting incidents of family members, etc., who sometimes want to come to these quarantine centers and want to find ways of getting in. It is in your own interest not to do so, because currently, even for the first cohort, about 14% of them have tested positive. It is in your own interest. Please cooperate with the protocols as have been outlined.
Well, you heard him, the Information Minister, Kojo Ponkroma. Now, Fred, there was also an issue of logistics for the frontline, medical professionals. Mm-hmm. Has that been resolved?
Well, the Director General of Ghana Health Service, Dr. Patrick Kuma, has also been addressing that. He says we've sent out a lot of PPEs, close to about 1,000, and more are being procured. And he mentions the fact that the workers who are in the front line, who are complaining, should just stay put. Their leaders will receive these PPEs and be handed to them. So that will be resolved. What was not discussed there, though, has to do with the ventilators we have in Ghana. That was not mentioned at all, and we'd like to hear from him. But let's hear him speak about the kind of logistics that they've deployed and what more we need.
One of the things we are doing, we advise all health workers and facility managers to ensure triaging at the outpatients, so that there's a pre-triaging where cases are selected to ensure that all respiratory cases are isolated and people are designated, people see them, so that we do not only protect staff but also protect other patients who have come to the outpatients for care. To do that, PPEs have been provided. Currently, we have done more than 10,000 PPEs distributed. We are going to ramp it up to about 50,000 within a short time. And when we talk about PPEs, there is a package of a set. There are some that are needed more. And so some of them, for example, we have over 3,000 coveralls, which is the one that you see covering people all over the place. You have the N95, which is a very highly, that spills out all kinds of, up to 95% of all debris and all viruses. But that's called an N95. We have more than 2,900 developed, distributed and more. With distributed goggles, we have face shields distributed, boots, among others, and we have more than 100,000 gloves of different shapes distributed. We are also ensuring that to build our capacity, all our staff who are currently on steady leave have been recalled back to come and join the force until the schools are open, so to keep our support. And we also know that retirees have been asked to come back, and doctors who are awaiting their financial clearance are also being recruited to participate in this exercise. The Honorable Minister, the Minister of Health, has procured more beds to expand our capacity, beds and mattresses, to look at that. We also have the training response team are trained across the whole region, and all regions are doing downstream training, including ambulance service staff and other people. Regions have identified treatment sites, because this may not just happen in Accra and Kumasi, and so all regions have beds allocated that should we have a case, this is where we have. Currently, we have about 545 beds allocated across the country, and it's expected that more will be identified. And as we get into the situation we need more, the facilities will be asked to look at more. We may also look at other opportunities to create space to manage the cases. The treatment protocols has been asked. I can't take you through all that, but the most important thing, as happening all over the world, is the fact that when you have these conditions, please call. When you have cough, fever, etc., that has of respiratory nature, don't just get into a taxi and go. Just call the numbers there. Now the 112 is working. Somebody will get back to you and make sure they will direct you as to how you seek care. Either they come to you. So we don't want a situation where everybody's rushing to the facility, and the process of getting there, you are distributing the cases. Mr. Minister, that's all I want to add. Thank you very much. Yes, we've also distributed more than, you see, I would say 10,000 sanitizers, but what you know is that facilities and hospitals are procuring a lot on their own. We have also given the regions the opportunity to procure additional PPEs out of the funds that we have given to them to protect staff, so that they can identify specifically what their facility needs are as far as their service providers. But let me add that when we say frontline staff, includes the security men, outpatients, records, pharmacists, everybody who will, I mentioned the pharmacists as well. Everybody who, by way, is part of the process of taking care of any patient who happen to be having a COVID-19. Thank you.
Patrick Kumar Abuaji, there's the Director General of the Ghana Health Service. Now, Fred, there was somebody at this press conference that I'm sure many parents were very glad to see. The
Dr.
Education Minister, Dr. Matthew Poku-Prempeh. He had updates on the closure of schools, didn't he?
Yes, he did. He talked about the programs they've put in place. You recall when the president announced the measures, he said that the Education Ministry should liaise with the communication and other ministries to roll out some programs so that students can continue to learn even though schools have been shut.
Yeah.
Now, those programs, right from the basic level to the university, tertiary level, have all been mapped out, and they will soon be rolled out. Students can go on the internet and take some lessons as have been planned for them. So I think that's good news. We are waiting for the day it starts.
All right. So actually, we can hear Dr. Opoku Prempeh briefly. Let's check that out now.
And the subsequent address on the Sunday, the 15th of March, the President announced the closure of all universities, senior high schools, basic schools, both public and private, beginning on the Monday, the 16th of March. It had become necessary to close schools because schools had had their index case. One of our institutions had had an index case. And as we speak, students of that institutions are quarantined on the campus. In that announcement, we still gave room for final year SHS students to continue in school and final year junior high students to continue in school because their exams were around the corner. Subsequently, the President charged us to ensure online programs to facilitate education continuing. In that time, UNESCO got in touch with us and started a facilitation arrangement such that Ghana could participate in online and traditional media broadcast so that education continues. Because UNESCO had realized that there's going to be a break in education for some time all around the world. In the meantime, West Africa Exams Council, the one who conducts our exams on our behalf, also announced the suspension of exams. So we had to bring the final year students to school, back at home, meaning the WASI students or the SHS 3 students and the BE students were all asked to go back home. I must emphasize that the school's closure is a total closure, both public and private schools. The school's closure is a total closure of all schools within the country called Ghana, both private and public. Any head of institution that attempts to keep students in school does so at his or her own risk.
Education Minister there, Dr. Matthew Opoku Prempeh. Now, why don't we wrap up with you, Fred? And as always, you can give us a few tips, can't you, about how to stay safe?
How to stay safe. Wash your hands under running water. I think we should compose a song from that. Wash your hands under running water, and you do so with soap. Where there's no water, try and use hand sanitizer. Keep a distance from the other person that you're talking to. Try and practice social distancing. All of these things were said by, it's been said by every professional, and we are repeating it. We have to say it as many times as possible. Do all of these things and we'll all be fine.
And for the love of God, do not touch your face.
Yeah.
That's the tough one, but try hard, don't touch your face. Thank you so much. Fred Smith is the head of our health desk here at Joy News.